Assalamualaikum everyone. I am Maryam Ndeem, final year optometry student from the University of Faisalabad, and the topic of my presentation is dry eyes. First of all, let's discuss what is dry eye. It is also called as keratoconjunctivitis sicca. Sicca simply means dryness, whereas kerato means cornea, and conjunctivitis is the inflammation of the conjunctiva. So it refers to the dryness of the cornea and conjunctiva along with inflammation of the conjunctiva, simply called as dry eye. It can occur due to inadequate tear volume, resulting into the unstable tear film and ocular diseases. Now let's discuss how does it occur, what causes dry eye, and what are the investigation methods and treatment procedures. There are several causes of dry eyes. It can include inadequate blinking, dusty and dry environment, increased sun exposure, medications, certain systemic associations, smoking, increased computer work, increased near tasks, less water intake, and frequent uses of contact lenses or mishandling of contact lenses especially. Dry eye could also be seen with several other conditions such as xerophthalmia, xerosis, and Sjogren's syndrome is one of the most frequently seen. It is actually an autoimmune disease which involves the salivary glands. Depending upon the pathophysiology, dry eye could be of two types. It could be of evaporative or it could result in the less tear production rate. The evaporative type is caused by lipid layer deficiency, whereas the aqueous layer deficiency causes the less tear production rate. The pathophysiology of the tear film, it actually has three layers. The first one is the lipid layer secreted by the meibomian glands. Lipids are released by lid movement during the blinking. It functions as preventing evaporation of aqueous layer. It maintains the thickness of the tear film. If it becomes defected, it will lead to the evaporative dry eye. Aqueous layer is the middle one, secreted by the main lacrimal glands 95% and the 5% by the lacrimal glands of the crossing and Wolf rings. Secretion includes basic plus greater component of reflex tearing, as the reflex tearing is caused by corneal and conjunctival sensory stimulation because it is mediated by the fifth cranial nerve. So it is reduced during sleep and double in response to any injury. The function of this layer is to provide atmospheric oxygen to the corneal epithelium. It does antibacterial activity, washes away all the debris, and provide cornea a clear refractive optical surface as it abolishes minute irregularities. Mucin layer is the innermost layer produced by the conjunctival goblet cells. Its function is to lubricate the corneal surface, and if it is defective, it is due to the aqueous deficiency plus evaporative state both combined, and it occurs mostly after chemical burns, vitamin A deficiency, or toxicity due to any medication or systemic associations. There is a long list of factors that causes dry eye, including aqueous layer deficiency, which includes Sjogren and non-Sjogren syndrome. Secondly, evaporative dry eye, and the others include vitamin A deficiency, lagophthalmos, etc. Now let's discuss what does the patient complain if he is having dry eye. The most encountered complaint is having irritation, itching, and gritty and burny sensation with watering, fatigue and tiredness of the eyes, and blurred vision and headache at the end of the day or after the prolonged tasks. To investigate the dry eye, we can perform Shimmer Test. It includes Shimmer Test 1 and 2. They tell us tear production rate, whereas the second test is the tear film breakup time. It tells us the stability of the tear film, and the third D, we can stain the cornea with several dyes to check the impression of the cornea. The time interval between the last blink and the appearance of random dry spot on the cornea of the patient indicates the breakup time of the tear film. It is Abnormal in aqueous tear deficiency as well as mammalian gland disorders. The normal reading of the butt is 10 seconds. We can assess tear film breakup time by installation of the 2% fluorescein into the lower lid fornix. We have to ask the patient to close the eyes and blink several times. Now what we have to do is to make patient first of all sit comfortably on the slit lamp, adjust the patient head with the headband and the chin on the chin rest. Now we have to examine through the slit lamp using the broad beam and blue filter. We have to note the appearance of any dry spot on the cornea. Any black spot occurring in less than 10 seconds after blinking indicates dry eye. Here on the right side, there is a slit lamp image of a healthy tear film while a defective and evaporative tear film on the right side. To assess the aqueous tear production, we use to perform Shimmer Test. There are two types of Shimmer tests, Shimmer Test 1 and Shimmer Test 2. The Shimmer Test 1 includes assessment of basic plus reflex secretion. What we have to do in this one is to fold up to 5 mm of Waterman filter paper, which is 35 mm long and 5 mm in width. It is inserted into the middle and outer third of the lower lid for 5 minutes. After 5 minutes, we will take it out gently and measure the wetting amount. Less than 10 mm in 5 minutes is considered as abnormal and dry eye, whereas the Shimmer Test 2 includes assessment of only basic secretion, as with the topical anesthesia we have blocked the reflex secretion. We will first of all instill topical anesthesia in the eye, dry excess tears from the inferior fornix, and then we will instill this Waterman filter paper folded up to 5 mm in the same manner as we have done earlier. Now after 5 minutes we will take it out gently and measure the amount of wetting. Less than 6 mm is considered as dry eye and abnormal. I have performed Shimmer Test 1 on this patient, and after 5 minutes the reading that came out is 4 mm in 5 minutes in the right eye and 6 mm in 5 minutes in the left eye. It indicates that the both eye are having dryness. We can also assess the ocular surface by staining, such as with rose bengal stain. It is a dye having affinity for dead epithelium cells, such as those cells having altered mucus layer. The corneal filaments and plaques can also be clearly seen under the red-free filter. The treatment options that we are having for the dry eye includes, first of all, the counseling of the patient to environmental modification. We must guide the patient to avoid smoking, avoid windy, dusty and dry areas, take breaks during computer and mobile use, especially the rule 20-20, that is, after every 20 minutes to look 20 feet away for 20 seconds, and enforce more blinking, drink a lot of water, avoid any toxic drug he is using that is causing harm to the eyes, improve vitamin A diet, wear high water content lenses, and stop any mishandling of the contact lenses. We can also prescribe several lubricating eye drops and gels. Mucolytic agents, punctal occlusion, and tarsorrhaphy are also in the available treatment options. Some new treatment options also include several external heating devices that used to treat mammalian gland dysfunctioning. These are directly applied on the eyelids. It produces specific heat for a specific time, and thereby the blockage of the meibomian gland is released, thus treating the dry eye. For now, I would like to wind up my video. I hope you will have find it informative. Thank you for watching.